Every patient over 60 who sits in my office gets asked the same question about their lungs. Not what supplements they take, whether they have ever smoked, and for how long. Because that one answer changes everything that follows, including which of the foods in this video are safe for them. I will explain what I mean by that. There is a supplement sold as a lung health product that in 2 large randomized trials increased lung cancer in smokers so clearly that both trials were stopped early. Both of them ahead of schedule. And it is still sitting on shelves in America today. So today I am going to give you the foods I actually recommend with the evidence behind each. Then I am going to tell you exactly what that supplement is. And then I'm going to tell you about a scan that could save your life, which fewer than 1 in 5 eligible Americans has ever had. Please stay to the end for those two. Let me start with what happens to lungs with age, because it is more specific than getting weaker. Around age 35, lung function begins a slow, steady decline in everyone. 3 things drive it. Your rib cage stiffens and the cartilage calcifies, so your chest expands less easily. Your diaphragm and the muscles between your ribs lose strength, exactly like every other muscle in the body. And the tiny air sacs, the alveoli, lose some of their elastic recoil, so a little more air stays trapped after each breath. That is normal aging, and it is gradual. Smoking accelerates that decline dramatically. But here's the encouraging part, and it is the reason this video is worth making. Some of that decline can be slowed, and in former smokers, there's evidence that some of it can be partially recovered. So let me give you the foods. Number 1 is tomatoes, and this has the most specific evidence of anything on the list. In 2017, researchers led by Dr. Vanessa Garcia Larson at Johns Hopkins published a study in the European Respiratory Journal. They measured diet and lung function in over 650 adults across Germany, Norway, and the United Kingdom, then repeated the lung function tests 10 years later. Adults eating more than 2 tomatoes a day had a slower decline in lung function than those eating less than 1. And in former smokers, the effect was considerably stronger. Ex-smokers with a diet high in tomatoes and fruit had roughly 80 milliliters less decline over that 10-year period. The lead author's interpretation was that diet might help repair some of the damage done by smoking. Now, the detail that matters most. The benefit appeared only with fresh tomatoes and fresh fruit. It was not seen with processed sources like tomato sauce. I do not know exactly why, and neither do the authors with certainty, but it is a consistent enough finding that I would not substitute the jar for the fruit. Number 2 is apples, and it comes from the same study. A higher total fruit intake was associated with slower decline, with apples specifically linked to better preservation of lung function. More than 3 portions of fresh fruit a day was the level associated with benefit. The proposed reason is flavonoids, and older British research had already found associations between apple intake and better lung function. Bananas showed a similar signal in that study. Again, fresh fruit, not juice. Number 3 is fatty fish. Salmon, sardines, mackerel, herring. The rationale here is inflammation. Chronic obstructive pulmonary disease is fundamentally an inflammatory disease of the airways, and omega-3 fats shift the balance of the compounds your body uses to build inflammatory signals. They also produce molecules that help actively resolve inflammation once it has served its purpose. I want to be honest that the trial evidence for omega-3s in COPD specifically is limited compared with the evidence in other conditions. This is a reasonable food, not a proven treatment. Number 4 is protein. And for lung patients, this is more important than most people realize. Your diaphragm is a muscle. The muscles between your ribs are muscles. When people lose muscle with age, they lose respiratory muscle too. And that directly affects how well they breathe and how well they clear their airways when coughing. In people with advanced COPD, low body weight and muscle loss are associated with worse outcomes. There is a second reason that is quite specific. Breathing is work, and in someone with significant lung disease, it consumes a substantial share of daily energy. Many patients with COPD find large meals make breathing harder because a full stomach pushes up against the diaphragm. The practical advice I give is smaller, more frequent, protein-rich meals rather than 3 large ones. Eggs, fish, poultry, yogurt, beans, lentils. And if you have kidney disease, your protein target comes from your doctor. Number 5 is water. And this one is simple and genuinely useful. The mucus lining your airways needs to stay thin enough to be moved out by the tiny hairs called cilia. When you are dehydrated, that mucus thickens and becomes harder to clear. For anyone with COPD or chronic bronchitis, that matters daily. Follow your own doctor's fluid guidance if you have heart failure or kidney disease. If this is useful, tell me in the comments whether you or someone close to you has ever smoked. I read them. Now the warning I promised, and I want you to listen closely. Because of studies showing that people who ate more carotene-rich vegetables had less lung cancer, researchers ran 2 large trials to test beta-carotene supplements directly. Everyone expected them to work. The Finnish ATBC trial enrolled over 29,000 male smokers. The American CARET trial enrolled over 18,000 smokers and asbestos-exposed workers. Both trials were stopped ahead of schedule, not because the supplement failed to help, because it caused harm. In CARET, the beta-carotene group had 28% more lung cancer and 17% higher overall mortality than placebo. The Finnish trial found an excess in lung cancer incidence as well. Follow-up published in the Journal of the National Cancer Institute found the elevated risk persisted for years after participants stopped taking the supplements. So please understand what that means. High-dose beta-carotene supplements increase lung cancer risk in people who smoke or have smoked heavily. If you have ever been a smoker, go and read the label of every supplement in your cabinet. Look for beta-carotene and look for vitamin A listed as retinol palmitate. Many multivitamins and eye health formulas contain it. Bring the bottle to your doctor or pharmacist. And here's the part I find genuinely fascinating and important. Eating carrots, sweet potatoes, and tomatoes does not carry this risk. The whole food is protective in observational studies. The isolated compound at high dose was harmful. This is the clearest example in all of nutrition science that a nutrient extracted from its food is not the same thing as the food. It is why I am cautious about supplements generally and why I would rather talk to you about tomatoes than pills. Now the scan. If you are between 50 and 80, have a 20-pack year smoking history, and currently smoke or quit within the past 15 years, you likely qualify for annual lung cancer screening with a low-dose CT scan. A pack year means 1 pack a day for a year. So a pack a day for 20 years, or 2 packs a day for 10. The large trials of this screening showed meaningful reductions in lung cancer death because it finds tumors when they are still small and treatable. And yet uptake in the United States has been strikingly low, with the large majority of eligible people never having been screened. Compare that to mammography or colonoscopy, where most eligible people have been. Lung cancer kills more Americans than breast, prostate, and colon cancer combined, and the screening test is a quick scan with no needles and no preparation. If that description fits you, please ask your doctor about it by name. Low-dose CT screening for lung cancer. I think it is the single most valuable sentence in this video. And 2 more things that are not food. Vaccination matters enormously for lungs specifically. Influenza, pneumococcal, COVID, and RSV vaccines all reduce serious respiratory infection, and each infection in someone with COPD can cause a permanent step down in function they never fully regain. And radon. Radon is a colorless, odorless gas that seeps into homes from the ground, and it is the second leading cause of lung cancer after smoking, and the leading cause among people who never smoked. A test kit costs very little. Most Americans have never tested their home. Now, the symptoms that mean you stop reading about food and call someone. Coughing up blood in any amount always needs evaluation. A cough lasting more than 3 weeks that is new or has changed in character. Unexplained weight loss. Increasing breathlessness with ordinary activities you used to manage comfortably. Chest pain that worsens with breathing. Repeated chest infections in the same place. And if you have COPD, sudden worsening of breathlessness or a change in the color or volume of your sputum may be an exacerbation, and treating those early genuinely preserves lung function. 3 honest statements before I close. Most of the dietary evidence here is observational, meaning it shows association rather than proof. Food cannot reverse established COPD or emphysema, and I am not going to suggest otherwise. And this video is education, not medical advice. I am a physician, but I am not your physician. Here's what I actually tell patients. If you still smoke, quitting is worth more than everything else in this video combined by an enormous margin. And it is worth doing at 70 and at 80. Lung function decline slows toward the normal rate after quitting at any age. After that, vaccines, screening if you qualify, treating your COPD properly, and staying physically active. Because exercise improves how efficiently you use the lung capacity you have. Then the tomatoes and the apples. They are real. And the ex-smoker data genuinely surprised me when I first read it. They are simply not first. Tell me in the comments if you have ever heard of low-dose CT screening before today. I ask because most of my own patients have not, and that is exactly the problem. Take care of yourselves, and I will see you in the next one.